He had spent more than 30 years working in emergency rooms. And in that time he had witnessed countless moments where life and death were separated by only a few minutes. Whenever he spoke to his patients, his voice carried the weight of experience and the calm of someone who had seen too much. Most people over 60, he often said, will not survive their first heart attack if they're alone. It wasn't fear-mongering. It was a hard, statistical truth. Nearly half of all deaths from heart attacks occur before the patient ever makes it to the hospital. Why does it happen? Because people hesitate. They second-guess themselves. They panic. And most of all, they don't know the simple, life-saving steps that can keep blood flowing long enough for help to arrive. Over and over again, he had watched patients wheeled into the emergency ward. People who could have lived if they had done just one or two things differently. In those first few minutes, crushing chest pain, sudden shortness of breath, dizziness, cold sweat. By the time they arrived, the golden window had already slammed shut. He would look at their families and tell them the truth no one wanted to hear. If he had called for help 10 minutes earlier, this might have ended differently. But there is good news. There are proven, science-backed actions that anyone can take even when completely alone, to dramatically increase their chances of survival. They're not gimmicks or myths. They are the very same techniques cardiologists teach their own patients. This veteran doctor wanted everyone, especially seniors, to understand 7 life-saving steps. 7 simple habits that can buy precious time when every second matters. He would begin each talk with a warm, personal question. How old are you? He'd ask with a smile, as if talking to an old friend in his clinic. And then he'd continue. If you're in your 60s or 70s, listen carefully. These steps could save your life or the life of someone you love someday. And that's when he would start the story of survival. The first and most critical action: call emergency services immediately. Don't wait. Don't try to be brave. Don't tell yourself, maybe it's just indigestion, or I'll wait and see. Every minute you delay, millions of heart cells die. Cardiologists have a simple saying: time is muscle. The longer you wait, the more of your heart muscle is lost. And the smaller your chance of walking out of the hospital alive. According to the American Heart Association, people who call emergency services within the first 5 to 10 minutes of symptoms have survival odds up to 50% higher than those who delay. Yet, tragically, many older adults still downplay their symptoms. 1 in 3 waits more than 2 hours before seeking help, often because they don't want to bother anyone or think they can just tough it out. That hesitation can be fatal. So if you're over 60 and ever feel a crushing pressure in your chest, shortness of breath, nausea, or that eerie cold sweat, act as if it's a heart attack until a doctor proves otherwise. Pick up the phone. Call emergency services immediately. Even if it turns out to be indigestion, you've lost nothing. But if it's a heart attack, and often it is, that call could save your life. And while waiting for help to arrive, what you do next is just as important. Step 2: chew an aspirin, if you're not allergic. Once the call for help has been made, your next move could mean the difference between life and death. Chew it, don't swallow it whole. Aspirin isn't just a painkiller. It's one of the most powerful clot-fighting drugs available without a prescription. A heart attack occurs when a clot blocks blood flow to the heart muscle. Aspirin helps stop that clot from growing, keeping a small but crucial stream of blood moving until professionals arrive. The science is clear. A landmark study in The Lancet found that taking aspirin during a heart attack reduced the risk of death by 23%. But speed matters. If you swallow the tablet whole, it can take 10 to 12 minutes to dissolve in your stomach. When you chew it, the active ingredient enters your bloodstream within minutes. And those minutes can mean everything. That single pill can be a bridge between life and death. If you're not allergic, and your doctor hasn't forbidden it, keep an uncoated bottle of aspirin in an easy-to-reach place. Doctors generally recommend 1 full, 325 mg tablet, chewed at the first sign of a heart attack. After the call and the aspirin, the next thing you do is about your body position. Step 3: loosen tight clothing and sit upright. When a heart attack strikes, every movement affects the strain on your heart. Belts, collars, or waistbands that are too tight can restrict circulation and make breathing harder. Sitting upright relieves pressure on your lungs and diaphragm, helping oxygen flow and reducing the workload on your struggling heart. This isn't just common sense, it's backed by science. The European Heart Journal reported that positioning patients upright during cardiac distress helps prevent fluid from flooding the lungs, which can make breathing feel like suffocation. Is a simple but vital step. When you feel that pain, sit upright. Relax your shoulders and free your chest and waist from any restriction. Give your heart room to breathe. Step 4. If you feel faint, cough forcefully. It sounds strange, almost unbelievable, but yes. Coughing can keep you alive for a little while. Doctors call it cough CPR. Here's how it works every time you cough hard. Your chest and diaphragm contract, building pressure inside your chest. That pressure pushes blood from the heart toward the brain, keeping you conscious when your circulation is collapsing. It's not a cure, but it can buy precious seconds. A study in the Journal of the American College of Cardiology showed that repeated strong coughing during certain heart rhythm disturbances kept patients conscious and maintained blood pressure until emergency treatment could be started. He told of a 69-year-old mechanic from Texas who suddenly felt dizzy during what turned out to be a massive heart attack. Alone in his workshop, he remembered hearing about cough CPR. He began coughing, again and again, staying conscious until paramedics arrived. Doctors later said those coughs likely prevented him from losing consciousness and suffering brain injury. If your vision starts to fade, your head spins, and your body feels like it's about to give out, take a deep breath. Then cough hard, every 2 or 3 seconds, until the dizziness passes or help arrives. Each cough acts like a manual heartbeat, keeping blood moving just long enough to save your brain and your life. Once you've stabilized yourself, the next step is to make sure help can actually reach you. Step 5. Unlock your door and keep your phone nearby. It sounds trivial, but it's critical. When a heart attack strikes, time is your most valuable resource. And even small obstacles can cost your life. Paramedics can break down doors, but it takes time. And every 10 minutes of delay reduces survival odds by nearly 10%. Always keep your phone within reach, especially if you live alone. Too many seniors leave it charging in another room. During a heart attack, even walking a few steps can cause collapse. Step 6. Take slow, deep breaths. Panic is your worst enemy. When fear floods your body, your brain releases adrenaline, speeding your heartbeat and raising blood pressure, forcing your already weak heart to work harder. Slow, deep breathing is one of the simplest and most effective ways to counter that reaction. It increases the oxygen reaching your blood and brain, while signaling your nervous system to relax. A study published in the Journal of Cardiopulmonary Rehabilitation and Prevention found that controlled breathing slowed heart rate and improved oxygen delivery, even in patients with severe heart disease. Inhale deeply through your nose until you feel your belly rise. Then exhale slowly through pursed lips, as if blowing gently through a straw. Aim for 6 to 8 breaths per minute, slow, steady, deliberate. Each breath buys your heart and brain a few more seconds of stability. And finally, the most important rule of all, the one that ties everything together. Step 7. Stay calm and completely still. When a heart attack strikes, your natural reaction is to move, to walk, to pace, to shake it off. But that instinct can kill you. The number 1 survival rule is this: do not move more than absolutely necessary. Every step, every strain forces your struggling heart to pump harder. During a heart attack, blood flow through your arteries is already blocked or reduced. Moving around increases oxygen demand that your heart simply can't supply. The European Heart Journal found that patients who stayed calm and motionless during heart attacks had far fewer complications and better outcomes than those who moved around in panic. Calmness isn't only physical, it's mental. When you panic, adrenaline floods your system, raising your heart rate and worsening the attack. Avoid the temptation to move, to open the door, or to reach for something. Those few steps could make you collapse before help arrives. Every movement revs it higher and risks burning it out completely. Stillness, calmness, and patience are what keep that engine running just long enough. Do less. Breathe more. Let help reach you. These 7 simple actions form a roadmap for survival. You can't predict when a heart attack will strike, but you can control how you respond. And that response can mean the difference between tragedy and another tomorrow. Knowledge saves lives. Always stay prepared. Always stay aware. Because when you understand your body and you know what to do, you can even outsmart death itself.